Thinking about some of those prevention efforts, why specifically are vaccines important in ensuring public health?
Vaccines can prevent disease. And the way they do this is they contain antigens, which are components that resemble the pathogen or the germ that causes disease. This enables your body to recognize the pathogen and to develop an immune response. And this way, when you do encounter that germ, your immune system is better able to fight it and prevent a severe or a deadly infection. Vaccines have resulted in the eradication of smallpox and in the elimination of many diseases. In fact, the World Health Organization in 2019 estimated that vaccines prevented 4 to 5 million deaths each year. Because of advancements in science and collaboration and hard work, we have safe and effective vaccines against COVID-19. And we have data on the great impact of these vaccines in limiting severe illness and death. We are learning more all the time about the vaccines and about COVID. And we are learning about the usefulness of booster vaccines. And it may end up being that, similar to influenza, we'll need to be vaccinated on a regular basis. But we don't know this yet. We do know, though, that these vaccines are powerful tools. And we think that these vaccines will enable us to get to the other side of this pandemic.
One follow-up question to that: what are the benefits that a DSP themselves can expect if they receive the full dose of the vaccine?
What we are seeing is that when we say full dose, I should probably provide some definitions, because it gets really complicated since there are all these different vaccines and they have different schedules, et cetera. So what we're calling a full dose is for the Pfizer or Moderna vaccines, it's a primary series of 2. For the Janssen or J&J vaccine, it's a single dose. However, we know that there are certain people, such as older people, people who have certain conditions, such as immunocompromised, they may not respond as well. And so, for example, for certain immunocompromised people, there's a recommendation for a 3rd dose of Pfizer or Moderna. And for people who are over the age of 65, for people who are 18 to 64 who live in a long-term care facility, for people who are 50 to 64 who have underlying conditions, we do recommend that these people get a booster, and the booster can be any of the vaccines that are available in the US. And then for people who are 18 to 64, who work in a high-risk setting and who are expected to be exposed to COVID, and people who are 18 to 49, who have underlying conditions that put them at increased risk for severe COVID, these are also people who are eligible for a booster. And your question was, what would we expect? So we do know that the vaccine effectiveness is very good. It's strong against having severe disease. Although we are seeing that there are cases of vaccine breakthrough, and in Minnesota, it's about 1.7% of people who've been vaccinated may have a breakthrough infection. And most of those are mild. There is a smaller component that go on to have hospitalization and get severe disease. But when we look at the data, if you are fully vaccinated, so this is without the booster, you are about 5 times less likely to get infected. And if you are fully vaccinated, you are more than 10 times, and in our data, it's 15 times, but if you look across national data, they report more than 10 times. You are much, much less likely to be hospitalized or have severe disease or death. I also want to mention, because the Janssen vaccine is a single dose and the effectiveness is a little lower, the CDC has recommended that if it's been 2 months since your one shot, they recommend for everybody who had gotten the J&J after 2 months to get a booster.